this is episode 1. This is Dr. Soni coming to you live from the basement of Lawrence, Kansas. Yes, you heard me right, Kansas. So today that I wanted to give you a little bit of a introduction, and I want you to learn a little bit more every day. And today what I want you to know about is, when is a disease? What is the difference between the disease and a syndrome and the disorder? Is a depression really a disease, or is it a disorder? Long time ago, I don't mean 1980s, I mean really long time ago, if you would have went to school, let's say year 180, if you would have went to school, what would they teach you? They would teach you that the blood is produced in the liver, and it's not. The blood is then sent to the heart, and it's not. Magically, the blood goes from right side of the heart to the left side of the heart, and during that process, it is infused with a divine and magical quality called pneuma. And that, the vitalized blood that is infused with the magical quality called the pneuma, goes to the left side. Left side pumps the blood to the rest of the body, and that's the end of it. So it was a one-way circulation. Now, let's fast forward. You now go to school in 81,000. So you go to the medical school in 81,000. And what would they teach you? Exactly the same damn thing. Minor variation, but nothing has improved. 1,500, you would have learned the same things. And so how is it that for 1,500 years we had not figured out that lungs are part of a cardiovascular system? All they had to do is find a dead body and cut it open, and therein which lied the problem. You were not allowed in a medical school to cut a body open, and it was considered, I don't know, what is it, blasphemy, sacrilege, whatever it is called, that it was just not allowed, and no progression of the science had occurred. Little later, we started learning about anatomical basis of the disease. So what's an anatomical basis of the disease? So somebody breaks a bone, and it's not really a disease, but it's a dysfunction, and you break a bone and you're not able to walk. Other anatomical basis of the disease is your liver is damaged when you were riding a horse and a fellow nightman jousts you or something, and it's like, oh, okay. So these are mechanical injuries, these are anatomical diseases that it takes a very, very long time to move from that concept to the infectious diseases, that there is a agent that is a microscopic agent. Now, until the microscope is invented, you can't understand what are the microscopic things that make us sick. So we have to wait for the invention of the microscope, so then we can learn the infectious diseases and things of that nature. So then we move from anatomical diseases to the infectious diseases. Now let's think about the superstitions that the people had before the diseases were named and were known to be caused by pathogens. Pathogens are bacteria, viruses, parasites, things that cause disease are called the pathogen. Patho is a root word meaning suffering. Pathology is the study of suffering. In other words, it's a study of diseases. So now we come 2,000 years and we now start learning a little bit more. Let's take the word influenza. Influenza. It was believed that the disease was caused by the influence of the planet, influences of outer planets that made us sick. And hence the name is still there, influenza. But now we know it is not. It has nothing to do with the positions of the planet in the solar system. Outer planets do not affect our health. I know people think otherwise, but trust me, they don't. Especially the influenza. Take another disease, malaria, infectious disease. Look at the name, mal, bad, air. The organism that causes the malaria is an intracellular parasite. It's called the Plasmodium vivax. And there are different kinds, and the mosquitoes bite somebody who has a disease, and they suck their blood, and then the mosquito itself has this Plasmodium vivax in its body, and it goes and bites your neighbor, and the neighbor gets the malaria. A mosquito bites the neighbor, comes and bites you, and now you have malaria. But then look at the name, malaria. It was thought to be caused by bad air. Had nothing to do with the bad air. So what was the disease cure? The cure for the malaria was light fires, thereby making the air even worse than it was before. If you couldn't breathe before, now you really can't breathe because you have a lot of pollution from burning woods and things of that nature, producing a lot of smoke. But during the process, when you produced all this, it cleared away mosquitoes, and the number of people dying from malaria kind of went down. So it was a standard practice then to burn a lot of wood and produce a lot of smoke in the city to purify the air, as it was called. But in fact, the air were a lot more polluted than it was before, but it kind of helped with the malaria. Now, we have all these superstitious, non-scientific way of curing diseases. We didn't understand it for a very, very long time. So now we are coming to a full circle. What is the difference between the disease and a syndrome? And what I'm trying to tell you today is that they are slightly different. Syndrome is a collection of symptoms that the patient experiences. Now, these symptoms are unrelated, but somehow all these symptoms happen at the same time. All the symptoms happen at the same time. So if you have these 7 symptoms that occur together, and we don't know what is causing these 7 symptoms, but they always happen together, we say you have a syndrome. Now, what is the most famous syndrome you know? Anybody? Oh, yes, I see you out there. Yes, you said Down syndrome? Absolutely, I agree with you, Down syndrome. Dr. Down, he discovered that the patients, the children with the Down syndrome, had this 6 or 7 constellation of signs that went together. And he was like incredibly racist guy, and I really want you to look him up, and we will talk about that later. But the syndrome means the collection of 7. Syndrome means collection of 6, 7. A number doesn't matter. It's a number of symptoms that go together. Number of symptoms that go together, I'll call syndrome. And I will tell you more about it next time. Right now, let's take a quick break, and we will be right back.
All right, Dad. How's it going?
It's going well.
Welcome back.
Going well.
Good
Yeah.
to see you.
Yeah.
Why don't you tell me a little bit more about the differences between syndrome and disease?
Very good. So, as we were breaking right before the break, we discussed that there's a collection of symptoms or signs. So let's start with that.
Okay.
So, ask me, what is the difference between the sign and a symptom?
Well, what's the difference between signs or symptoms?
Very good. A sign is something that I can see, measure, observe.
Mm-hmm.
You can say, I see you have a bunch of zits on your face. No, you don't, but I'm just saying. That would be a sign I can see. You tell me, it hurts over here. Pain, then is a
It's a sign?
symptom.
No, it's a symptom.
I cannot see.
Okay. Okay, I see.
I cannot observe. You tell me I have a fever. I put a thermometer and I can measure it, I can see it, I can touch. You feel hot.
Mm-hmm.
Sign or symptom?
Symptom. Sign.
Thank you.
You got this.
Measure it, see it. The symptoms, I cannot see it, I can only...
Symptoms you can't see.
Symptoms you cannot see.
Okay.
I have to
Just
listen to
describe
you. I have a tummy ache.
Okay.
Symptom.
Symptom.
Yes,
symptom.
you got a profuse diarrhea.
Right, but if
Sign.
I'm missing my hand, that's a sign.
Mm-hmm.
Got it.
So you have signs and symptoms. Then the syndrome is a collection of this sign and sometimes symptoms and sometimes not.
Okay.
Okay. So the most famous was this Down syndrome.
Yeah.
So what he started doing was he started observing all these children that had Down syndrome.
Mm-hmm.
Now it wasn't called Down syndrome at that time because him being Dr. Down had not named it. And so this is how incredibly stupid and racist he really was.
Uh-huh.
So he thought that in the uterus, when the baby is developing, the fetus is developing, it goes through all the evolutionary stages. So baby is first black or African.
Okay.
Okay, I know. And then the baby then goes and becomes Asian feature, and then eventually the baby becomes white. Now he has no explanation as to why there are these different races and all this, but in his mind, in the uterus, you go through all this, and then the Down syndromes, they were stuck in a stage called the Mongoloid stage, as opposed to the African stage, and so he thought that because they have this thing, this one of the sign that is observable. So if you look at all the Down syndrome children, they have a characteristic look.
Mm-hmm.
You can even see a tiger and look at the tiger's face and say, this tiger has a Down syndrome, you can tell. Because it has that characteristic facial features.
Mm-hmm.
And even the tiger, you can see the eye, the face. What he missed was the cause, the underlying cause is not getting stuck in some kind of developmental stage. Underlying cause of the Down syndrome is called non-disjunction. So in the egg, when the egg is old, after the fertilization, the separation of certain chromosomes is to be occurring, and it's called trisomy 21. You have a 3 copy of the chromosome 21. Everybody else has 2 copy, one from a parent and one from mother. For whatever reason, it doesn't happen. It's called the non-disjunction. The chromosome failed to separate, and the embryo ends up with an extra copy of chromosome 21.
Mm-hmm.
Because of that non-disjunction, whatever reason, there is a similar feature. No matter what the racial background, no matter what the ethnic background, there is this common features. So if you look at the Down syndrome, so you see that if you look at your hand, you will see these 3 lines.
Mm-hmm.
But if you looked at the Down syndrome child, would have only 1 line in the middle, and the hand would bend like this, as opposed to if you bend it, you will see the lines are where the hand bends. And like I said, incredibly racist. It is called a simian crease, like a monkey palm
Yeah.
will have it, and these children have it. And this is what I'm saying, that this guy was completely devoid of science.
Sure.
And he come up with this idea of syndrome. So now we have many syndrome. And we don't know what's causing the disease. Like he didn't know there was the genetic problem. And they were not even aware of that there is a thing called genes when he's describing the syndrome. So he misses the boat completely, yet his name is now, it's there for him, Down syndrome. But he did not know why it was causing, what was the underlying problem.
Mm-hmm.
So he is describing a syndrome. The underlying problem is what? Say it with me, non-disjunction. Disjunction. Not disjunction meaning unjoining.
Mm.
It forgets, it doesn't do separation.
Mm.
Non-disjunction is a fancy way of saying separation.
Okay.
The separation doesn't happen appropriately.
Okay.
Okay, so you get an extra copy of this chromosome. It has nothing to do with the features that you can observe. In fact, there is a very little correlation that we can explain why this set of features go together, other than its externally observable sign.
Mm.
So the syndromes then is not very scientific way of classifying anything.
Huh. Okay.
Because just because things go together doesn't mean they are related in any way.
Sure.
Nor does it have anything to do with why the disease is caused.
Okay.
So the syndrome then is just something that is there. It's a syndrome. There are numerous syndromes now that we have, constellation of signs and symptoms that go together. Syndrome. Disorder. When we come in and talk about the mental health, we talk about disorder. So the depression, is it a disease? Is it not a disease? It's a disorder. The disorder then, it refers to the functionality. Okay. So I have a pain in my knee, and is it a disorder? Is it a disease? I know it's a dysfunction. The dysfunction. Let's talk about the function. I'm a mailman, for example. I'm just saying.
Mm-hmm.
And a mailman has a lot of knee pain, and he's not able to function as a mailman. It's a problem. So that's a dysfunction.
Okay.
A football player loses a leg below knee. It's a problem because he can no longer function as a football player.
Sure.
However, he can write a code.
Sure.
He can do podcasts.
Sure.
Okay, so it's not a dysfunction. Losing a knee is not a dysfunction for a cameraman or a podcast, but losing a knee is a problem for a running back,
Right.
mailman. And it's a dysfunction. So we want to separate all these things: dysfunction, disorder, syndrome, and a disease.
Mm-hmm.
They sound very similar, they're very separate. So when it comes to mental health then, it's like the syndrome problem. Remember the underlying problem was the non-disjunction?
Mm-hmm.
And we often don't know what the underlying problem is in the mental health.
Mm-hmm.
So what are we describing? Syndrome, collection of signs and symptoms. Okay? So one of the things that I wanted to talk about was the depression. So the depression then, right now, the way we describe it is that of a syndrome. So we have 5 or 6 different things that are occurring together. We do not know the underlying biological problem, but we know that 6 things go together.
Mm-hmm.
And how do we know that the 6 things go together? Well, what if there were only 5, or maybe 7 or 8? And the answer is that we don't. Bunch of old men get in the room and they decide if these things are together, that's what a disorder is.
Mm-hmm.
And then after a while, they will add one or drop one, and it's a consensus. There isn't any scientific reason for it, like a non-disjunction or a broken bone, the underlying disease. So when it comes to depression, all we can say then is that it's a syndrome and all these things go together. So what are the things that go together?
Mm-hmm.
So the things that go together that makes up a depression disorder, it is a syndrome, and that is a lack of energy, anhedonia. Anhedonia is a fancy word that means you fail to experience joy. Lack of energy, lack of motivation, sleep problems, suicidal thoughts, something we call a psychomotor retardation. What is a fancy way of saying that people move slowly when they're depressed.
Okay.
Sometimes you can see, people going down the hall, and you can pick out which one is manic and which one is depressed. And so these are all these things, and just like in a Down syndrome, there is no underlying disease. So now we know a lot more about brain than we did before, but the classification of disease is still stuck at the level of syndrome when it comes to mental health. And then we define the dysfunction and disorder is that, can you function? And so we have then functioning people and non-functioning people.
I see.
So we would say, oh, my dad is a functioning alcoholic. What does that mean? What is his function? He's a computer programmer. That's his function. He can still get up in the morning, go to work, write codes, bring home paycheck, and he can drink all day long. The functioning alcoholic, he can drive, he can come home, he doesn't get pulled over for DUI, he doesn't come home and beat wife and kids and all that, and but is he alcoholic? Absolutely. But is he functioning? So there is dysfunction and there is a dysfunction. The dysfunction is that you constantly are getting pulled over, you're losing your job, losing relationship, now all these things, now there's a problem. One more I forgot to tell you about the disorder and a trait. Ask me what is a trait.
So what's trait?
I thought you would never ask. The trait then is, there is an obsessive compulsive disorder. So somebody who becomes an astronaut, well, you don't get to be an astronaut or even a psychiatrist or a podcaster or a film director, Spielberg, all this.
Sure.
All right. So they don't get to be where they are because they give up. So at what point do we say that Spielberg has OCD? Because he doesn't give up. He takes the one scene, he says, takes it 5 times until it's perfect. George Lucas does whatever he does. And so there has to be that drive that says, I'm not going to stop until I get what I want, until I get it perfect. And that is a successful design. So are they functioning?
Sure, yes.
Do they have a disorder? No. So this is a trait. It's not getting in the
I
way.
see. Okay.
Now, I got to be a doctor, and I failed a couple of times. And you have to keep going. At what point am I OCD? Well, you're not. You have a trait. You gotta have that trait. People who give up at the first sign and don't stick to it don't have a trait. It's not a disorder either. So it's difficult then to say, is it a trait? Is it a disorder? So disorder is only a disorder if it gets in the way of you functioning.
Got it. Okay.
Now, if I want everything perfect, if something is moved 1 inch this way or that way, am I going to be functioning person? I could be. But if I am always concerned and I can't get anything passed because I can't finish this project because it's not perfect. And now it's a problem. You are so hung up on minor details that you can't finish the project. And then it becomes a disorder. So is it good to wash your hand? Absolutely. You should wash your hand, especially now. But the OCD people get stuck in the bathroom for 6 hours.
Right.
Staying clean is not a problem. It's a good trait. Surgeons have it. I wouldn't want it any other way. If my surgeon didn't have an OCD trait, I'll say, I'll wait. Bring me one that has an OCD trait. One is going to scrub his hands for 22 minutes. But a guy, if he's so preoccupied with 1-inch movement of a pencil that he cannot finish, and then now it's a problem. Right. So you see how the variation of the disease and syndrome and disorder. Now next time, we are going to focus more about depression and then see what is the underlying problem. So how do we go from the syndrome-based description to a biological-based description? Okay. Like we did with the Down syndrome, we saw that they had a collection of signs and symptoms, but that's not the underlying biological cause. The biological cause is chromosome 21 trisomy, 3somy bodies. There are 3 bodies, and that's a problem. There are only supposed to be 2, but now we have 3. Underlying problem we didn't know, and now we do. But when it comes to mental health, we are still not at the stage where we can say this particular chromosome or this particular enzyme or this particular protein is deficient, and that's how we have the mental health problem. So the mental health problem that is very, very complex, not caused by one simple error, not one simple pathogen that caused this disease. So that is why the solutions are also complex. So now we are understanding a little bit more about the mental health. Now we are saying, oh, so the syndromes are slightly different, and all these words have meaning. And I want our audience to know the difference between these different words. And if you can understand the words, then you can understand the concepts, and you can then separate and become a better consumer. And that is all we are wanting. That you get a better quality of life by watching Dr. Soni's podcast. Yeah, so what I want you to do out in the video land is to become a better consumer. And then you can take control of your health. This concludes then, does it not?
Sure.
This concludes our inaugurating, is it, how do you say it? Yeah.
Sure.
The premiere podcast. What are we calling this?
eshrink.
Yes, I totally forgot about it. I am your eshrink. Thank you for joining us. We will see you next time.